So yeah, welcome everybody to Green Peak Alliance for Your Health. Green Peak Alliance is an organization that fosters healthy communities in Vermont. And today on our show, we're going to be talking about just the concept of prevention. We're here with our guest, Claudia Marieb, and she's a substance abuse prevention consultant with ADAP, which is the Division of Alcohol and Drug Abuse Programs of the Vermont Department of Health. It will be good to talk about prevention because it's an often misunderstood term. It's a very broad term, and it's great to have Claudia here to elucidate many of these concepts. So, Claudia, welcome.
Thank you, Liz. Thanks for inviting me.
Of course. And can you tell us, what do we mean when we talk about prevention?
It is actually a great question because people think everything means prevention. Specifically with us, we're talking about preventing a behavioral health issue. And so when we're talking about substance misuse prevention, we're talking about preventing the misuse and of substances and also substance use disorder down the line. The field is really interesting because when people hear that, they think, oh, that then I do education about the harms of substances. But the field of prevention, what we found is that simply educating about the different dangers and risks involved with substances doesn't provide strong results if we do that alone. So the field is built on looking at the underlying causes. Those are interpersonal, personal, and societal factors. And trying to change those. And through changing those, we can impact eventual substance misuse and substance use disorder.
Mm. And so how does it work? How do you make those changes?
Well, like I said, we look at the underlying causes, and it's worth noting that one underlying cause we can't change, and it's a big one, and that is genetics. And genetics account for between 40 and 60% of a person's vulnerability to addiction. So that is really big. And I think we all need to realize that has a big impact, and some people are predisposed. So what we can do though, is set things up so someone who's predisposed has the best shot possible. And when we do that, we also make positive changes in the community that help everyone. So prevention has been extensively studied, and they've looked at what specific risk factors and protective factors will influence or do influence someone's vulnerability to substance use disorder later on. And like I said, we can't change genetics, but there are things we can change. And the risk factors, we try to reduce those, and the protective factors, we try to increase or bolster. Mm-hmm. So an example, we often work and focus on youth, and that's because there's this very strong data point about the age of onset of use, and that is the younger someone starts using any substance is the greater the likelihood of a problem with addiction or substance use disorder later on in life. So there was a study of youth who started drinking before the age of 15 are 6 times more likely to develop alcohol use disorder later on in life compared to those who started after age of 21.
That's a huge number.
It's amazing, 6 times.
Yeah.
Yeah.
And so what are some of the things we do to just work with that, to try to prevent that when that's such a huge factor?
Yeah, and this is where prevention can get confusing for people because it's not one thing, it's like everything. So if we think about someone, say we go back to the example of someone having a genetic predisposition, and say also that their parents are misusing substances at home, that's another risk factor. So that's 2 risk factors that they have. And then I think about them, say they're an 11-year-old boy and they step out of the house, and what things do we have in place that are risk factors or protective factors that can influence and support that person? And one would be reducing the risk factor of going past convenience stores that create a cultural norm of everyone is using. So the alcohol advertising, the tobacco right up in front, the placement of those products, the school environment, are there teachers that are trusted, that someone can confide in and talk with, that is a protective factor. Is that in existence there? Clear consequences in school for behavior stuff that are not punitive and isolating, and yet are clear and in place, clear boundaries, mentoring programs, so significant non-parental adults in someone's life, substance-free activities that are cool and become the social norm, rather than, we have the alcohol lobby, and also part of just our youth culture is about how the way to have fun is through using substances. So anything we can do that increases protective factors and reduces risk factors will help that person, as well as create a social environment that benefits everyone.
You had used that term social norms. Would you like to say more about what those are and what that means?
Yeah, I am really glad you asked that, because I love the idea of social norms. It's really based on kind of anthropology and our culture, and that our culture, belonging to our culture, is so important to the human condition that we, without even thinking of it, try to match the culture. And so an example is, okay, if I'm a parent of a teenager and I think the social norm is that I don't want to make a fuss and check in to be sure that the party where my child went, just to be sure that the parents are going to be around and stuff like that. But I feel that that's not culturally appropriate. I might not do it. But the data suggests that most parents are in favor of hearing from parents and being sure that we're all checking in on kids. And so a social norm campaign, for example, can encourage parents, can actually tell the truth about that, can tell the truth that most parents want to make a call like that, and most parents are receptive to receiving a call like that. So that's changing like my idea of what the norm is. And of course, social norms are around use itself. When we're young, and we find this with young people, is that they consistently overestimate the amount of use happening. They think that everyone's using. If they're not, they're the only one who isn't. To belong, actually, I have a niece who says this, to belong, she doesn't actually want to drink, but she nurses a drink all night long so she looks like she's belonging. It's a huge factor. So some of our social norming is, and we work with youth on this, is them creating campaigns that tell the truth. Like, most of us are not binge drinking every weekend, or whatever the truth is. And we do that using actual data from our youth risk behavior survey. So those are some ideas of social norming campaigns.
Great, those are great examples. And with prevention, it's one of the challenges with it is it's hard to quantify or prove, but it is effective. Can you describe the ways prevention saves money and saves lives?
Yeah. When you ask that question, Liz, I think about the opioid crisis. We've lost so many young lives, and it's affected the community so greatly. So our numbers of people with opioid use disorder are actually quite low, but the impact has been high. So it's because with any addiction, the substance becomes primary. So I will do anything for it. I will steal, I will commit crime, I will hurt the people I love, I will possibly be violent, and I may overdose and lose life that way. So anything we can do with prevention impacts all of those things, not only for the person, but for their families and for the community too. One really concrete example of a very big law that resulted in saving lives is when the minimum legal drinking age in 1984 changed to 21 years old. States had various minimum legal drinking ages before that, and those that made the change to 21 saw a 16% decrease in traffic fatalities at that time. People who are my age, I graduated high school in 1982. Remember, it wasn't unusual that you'd hear of young people in traffic fatalities, much more than you do now.
Well, that's a clear example of how policies can really just change the landscape.
Exactly. That was a big national policy. We've seen that with tobacco too. I think tobacco is a really great example of how policy can change things when, and back to social norms, the policy changes the social norms. So it used to be the social norm that, people smoking in restaurants and things like that, acceptable, maybe even cool. And now that has taken a complete 180 where it's not allowed, but also the social norm around it is there's this respect for others and secondhand smoke. And that didn't exist. It even wasn't that long ago that change happened. So that's a really clear example of how policy, along with education of the public, helped change social norm. And that has really impacted behavior. Our tobacco numbers have gone way down because of a combination of policy and how policy affects social norms.
Right. In our area of prevention, we focus on substance use prevention, but how is substance misuse prevention linked to other types of prevention, like preventing mental health issues, for example?
Mm-hmm. That's a great question. Remember, I talked about the risk and protective factors involved. So the field of mental health has, and many behavioral health issues have similar risk and protective factors that have been studied. And sometimes these overlap. So with substance use disorder and mental health, two that come to mind that are similar, that are the same, are shared, is low parental warmth is a risk factor for both, and also poor grades and academic performance. So those are just examples. There's many of them. But if we work to change, like reduce those risk factors, support parents in their parenting, support schools and individual attention enough so kids can succeed in school, we're changing the outcome for both mental health and substance use disorder. They often work in tandem, those things.
It's very interesting. And when you mentioned low parental warmth, I think of our previous show, which was with the Family Place, with the Parent-Child Center, and that's how they are tied into this whole prevention. They're one of our collaborators in building a healthy community because they work on that issue of early childhood development and parenting skills. So that's a compelling example.
That's a great example, and that's so powerful because it's when the kids are so young developmentally and can really build a strong foundation.
Yeah. Talking about those things, that makes me think of primary, secondary, tertiary prevention. Can you tell us about those different types of prevention and why they're each important?
Sure. We have this model. It's consistent with the Institute of Medicine model, or sometimes called the continuum of care. And it starts with promotion, moves to prevention, then intervention, then treatment and recovery. And as you move, well, one thing I want to say about this is as you move further along, I should have said this when you asked me about costs, but okay, just erase that sentence. So as you move further along, things are more expensive. So as you can imagine, medically assisted treatment, residential treatment, the intervention needed once a substance use disorder has developed, the loss of jobs, the loss of relationships, it's much more intensive at that stage compared to at the beginning stages.
Yeah.
So with primary prevention, we're looking at intervening before risky behaviors develop. So when we talked about onset of use and trying to delay onset of use, that's primary prevention. Because of that risk factor, it also helps because the adolescent brain isn't fully developed until age 25. So that gives people more of a chance for when they do start using substances to be able to do that in a responsible way and not go on the slippery slope to misuse, abuse, and substance use disorder. Secondary prevention is when some signs of risk have shown up, but it's not a full-blown disease yet. So this could be underage drinking party. I'm thinking of ways people might get involved with the law, or driving while under the influence of alcohol ticket. If they don't have full-blown substance use disorder, some of the interventions that happen then, like at our youth diversion, our court diversion programs, and also we have educational programs for people with DUIs, can provide enough support and education that it veers someone off a track that was risky and heading towards substance use disorder at that point. And the third one you asked was tertiary, and that's after someone has a disease, and it's about treatment and recovery and maintenance from that. And a way that ties in with prevention is a big risk factor for developing a substance use disorder is having a parent that has a substance use disorder. Some of that's tied in with genetics, but also if someone is getting, as a parent, treatment for substance use disorder, they're in recovery, that will help provide more of a protective factor for their children.
Great. Can you comment on how prevention works? And I mean, can you just say the different roles people have in prevention? You're a substance abuse prevention consultant. I'm a communications specialist. I work on some of those campaigns you mentioned. But there's a lot of different things people do in prevention, and many different activities. What do you see? What do you have to say about how it all fits in?
I think you are a great example because you are a communications specialist. And I think there are so many different skills that prevention professionals have, but they're often not what people think that they have. So we're not necessarily standing in front of classrooms of students talking about the harms, right? We are the ones that hold the science of the risk and protective factors and the science of prevention. A lot of what we do is outreach with community partners, like the family place, like law enforcement, like schools, like towns, places that can have an impact through doing what they do through the lens of prevention and providing more protective factors, reducing risk factors, and creating a whole environment. Like prevention professionals themselves could not create this whole environment. We might be able to run specific programming, but to create a whole society, we need many, many different players. So often a prevention professional is coordinating with others who are doing direct work that benefits.
Right. Can we talk about just a couple of examples of that? I mean, I think of National Prescription Drug Take-Back Day, right? Where that usually happens twice a year. We encourage people to bring their unused medications and dispose of them properly, so they're just, not lingering around. But we work with police departments, and they help us collect these medications in drop boxes and things. And there are drop boxes at many police stations year round. And so that's one example where, we, the prevention people, are working with law enforcement and the community. They come out and help us out by getting rid of the medications in their homes. What are some other things that come to mind about how, there's so many of how we work with schools, people work with schools and campaigns and things like that?
Right. One example that comes to mind is a fabulous program that is a partnership with Stratton Mountain. It's a refuse to use program. And so that's a business owner. And the program involves the Collaborative, which is a substance abuse prevention coalition. I'm sorry, I'm going to scratch that. It's a community coalition, and substance misuse prevention is one of their goals. And they have developed this program where students who commit to not use and engage in a certain amount of educational programming and support, Stratton Mountain provides a free ski pass for those students. It's an amazing win-win. That provides the students also with substance-free, healthy outdoor activities, which builds a lot of protective factors, and it influences those social norms that we talked about too. So that's one example of a partnership. Another one is with towns. So towns can really help with the social norms of the town through policy. So examples of that are a town that might pass a policy that has to do with the placement of adult-only products in stores. So the cigarettes aren't, and the vaping products aren't right front and center, nor is the alcohol. Or they might pass an ordinance or have a guideline about public events that happen in the parks in that town, and that when public events happen there and there's going to be substances, well, first of all, that should be checked if there can be substances, and if there can be, the town can put in place some guidelines so it's not front and center, that families can enjoy the event, and that healthy use of substances can be shown as a responsible accent to the event, but not the whole event. Again, talking about the social norms that we want to create in town, of places that are being healthy, where there's responsible use, where there's help if people are in trouble with substance use disorder, where belonging doesn't mean that you need to binge or misuse.
Right, that's great. I'm glad we talked about that, because I was going to ask you about the importance of community partners, and how this responsibility of eliminating some of these problems is not just on families or teachers teaching health class. It's really on all of us, and we all want to be healthy and live in as healthy as possible community. So yeah, you've answered so many of my questions. Is there anything else you'd like to say on this topic of prevention?
Well, I think I focused a lot on the built environments and communities, and something I do want to stress is just what you said about like all of us playing a role. Because relationships are so important, I would just want to stress that people, through your relationships, through caring about someone, through not judging when someone is struggling with substances, through supporting a youth even though they're misbehaving, those significant relationships can really make a difference in someone's life. It can help them get help if they need help. It can help them come back instead of isolate if they've misbehaved, that type of thing. So the more we can show up, yes, with boundaries and with clear consequences and things like that, but know that our relationships with others can have a big impact on behavioral health issues like substance use disorder.
That's an important point.
I want to leave with that. Yeah.
Well, thank you very much, Claudia. This has been great to talk with you.
Okay, thank you for having me.